Okay, so ladies and gentlemen, you are welcome to my today's video. So in today's video, we are going to look at the inborn errors of carbohydrate metabolism. So these are the categories of the disease that we are going to look at. We are going to look at hemolytic anemia due to hexokinase deficiency, pyruvate kinase deficiency, and glucose 6-phosphate dehydrogenase deficiency. And then we're also going to look at the pyruvate dehydrogenase deficiency, carbohydrate intolerance disorders, which includes lactose intolerance, fructose intolerance, and then fructosuria, galactosemia, galactosemia, then dysuria, glycogen storage disease, and mucopolysaccharidosis. So let's start with the hemolytic anemia. So hexokinase deficiency, we know that, of course, in glycolysis, hexokinase is the first enzymes that involve in glucose metabolisms, where the enzymes combat glucose, where the enzymes combat glucose to glucose 6-phosphates. So of course, the enzymes that catalyze this reaction is hexokinase. And of course, one thing that we should understand is that glycolysis involves a series of steps that involve it involves exactly 10 steps, where from this glucose is converted into glucose 6-phosphate, from glucose 6-phosphate to fructose 6-phosphate, and from fructose 6-phosphate to fructose 1,6-bisphosphate. Then from there, from fructose 1,6-bisphosphate, then it will now be converted to dihydroxyacetone phosphate and glyceraldehyde 3-phosphate, and then the glyceraldehyde 3-phosphate will be converted, and of course it will come to a stage where we are going to generate 2,3-bisphosphoglycerate. So now what happens if this hexokinase is deficient? If hexokinase is deficient, it means that this reaction will be blocked. So meaning that glucose 6-phosphate will not be, glucose cannot be converted into glucose 6-phosphate. So therefore, the whole of the glycolysis will be blocked, and therefore 2,3-bisphosphoglycerate will not be generated. So now, what is the relationship between 2,3-bisphosphoglycerates and, of course, hemolytic anemia or anemia? So it is a very rare to have hexokinase deficiency among all the hemolytic disorders. And of course, in the glycolysis in the red blood cells, it's linked with 2,3-bisphosphoglycerate production and essential for oxygen transport. So the red blood cell is linked to 2,3-bisphosphoglycerate in terms of the oxygen transport. So it means that if this enzyme is deficiency, so it means that in the deficiency of hexokinase, then the synthesis and the concentration of 2,3-bisphosphoglycerate are low in the red blood cell. So of course we are talking about in the red blood cell, we generate 2,3-bisphosphoglycerates. And of course, if this enzyme is deficient, that is hexokinase, it means that 2,3-bisphosphoglycerates will actually not be synthesized. So the concentration of 2,3-bisphosphoglycerate will be very low in the red blood cell. Therefore, so the oxygen unload to the tissues decreases. So conditions lead to hemolysis. So it means that if there is deficiency of this 2,3-bisphosphoglycerate, it means that there will be low delivery of oxygen. So there will be low oxygen delivery into the body tissue, and as a result of that low delivery of oxygen, then it will now to hemolysis. So this is actually hemolytic anemia due to hexokinase deficiency, which blocked the production of 2,3-bisphosphoglycerate, which is important in the oxygen transport, and as a result of that, then the oxygen delivery in the body tissues of the body will be very, very low. So then as a result of that, it means that so therefore deficiency of these enzymes will block the production of 2,3-bisphosphoglycerates. And of course, since there is no production or there is a low concentration of 2,3-bisphosphoglycerate, it means that there will be low oxygen or there will be low delivery of oxygen to the tissue. And of course, these conditions will lead to hemolysis of the red blood cells. Okay, so then the next thing is actually pyruvate kinase deficiency. So it is an autosomal recessive disorder, and most common red blood cells called, of course, enzymopathy after glucose 6-phosphate dehydrogenase deficiency. So pyruvate kinase catalyzes the conversion of phosphoenol pyruvate to pyruvate with the generation of ATP. So this enzyme is actually involved in the substrate level phosphorylation, where we have pyruvate, where we have phosphoenol pyruvate, where phosphoenol pyruvate is converted into pyruvate using an enzyme called pyruvate kinase. And at this stage, ATP is generated by using, of course, ATP. So this is actually one of the steps of substrate level phosphorylation of glycolysis where ATP are generated. So it means that if this enzyme is deficient, it means that ATP is not generated. And of course, this step in glycolysis includes these 2 molecules of phosphoenol pyruvate that are converted into 2 molecules of pyruvate, and of course at this stage is the 2 ATP that is generated. So as a result of this deficiency, there will be an inadequate ATP generation. Of course, this leads to premature of the red blood cells, and of course, which is called a free kill cell. So on the other hand, in the patients with pyruvate kinase deficiency, then the level of 2,3-bisphosphoglycerate in the red blood cell is going to be very high, resulting in low oxygen affinity of hemoglobin observed. So of course, since if these enzymes is deficient, it means that there will be a substrate accumulation. So which of the substrate that will be accumulated, of course, is this phosphoenol pyruvate. But of course, remember that from this phosphoenol pyruvate, most of the other reactions, they are reversible reactions. So therefore, at the end, this phosphoenol pyruvate, when it accumulated, then it will now start converting back to generate a reversible product. So as a result of that, there will be a high concentration of 2,3-bisphosphoglycerate in the red blood cell. And of course, this high concentration of the red blood cells affect the affinity of oxygen. It will affect the affinity of oxygen to hemoglobin. So this is what is happening here. So two things here actually affect the red blood cells. Number one, there will be a high 2,3-bisphosphoglycerate which affects the hemoglobin affinity to oxygen, and then also the inadequate ATP generation, which also cause hemolysis of the red blood cells, of the red blood cell. So then the next thing that we are going to look at under the skill cell or the ammonia. So look at what happened here. This is a blood film. So we have pyruvate deficiency. So characteristics actually leads to the production of prickle cells. So this is, of course, we can see clearly, these are the prickle cells. These are the prickle cells due to pyruvate kinase deficiency. So, and then, of course, the next thing is glucose 6-phosphate deficiency, dehydrogenase deficiency. So, now glucose 6-phosphate dehydrogenase deficiency is a X-linked recessive disorder, and the frequency it occurs in is 1 in 5,000 baht. So it means that in 5,000 baht, there is a likelihood that one person or one child will have glucose 6-phosphate dehydrogenase deficiency. And this deficiency occurs in all the cells of affected individual, but it is more severe in red blood cell, because red blood cells is depend only on hexose monophosphate shunt for their NADPH requirement. So therefore, glucose 6-phosphate dehydrogenase deficiency leads to impaired NADPH production. So oxidized glutathione is not converted into its reduced form. So as a result of that, there will be oxidative stress, which actually affects the membrane of the red blood cells, and that leads to anemia. So, ladies and gentlemen, of course, so low NADPH concentration also result in accumulation of what we call methemoglobin and peroxide in the red blood cells, which causes a loss of red blood cells membrane in integrity. Till now, it is mostly asymptomatic. So this is actually some of the cases. So, but when the enzymes deficient, or when enzyme deficient is subject exposed to severe infection, administered antioxidants such as antimalarial drugs, antibiotics, acetanilides, and of course, this can slow other cases. But favism, that is ingestion of fava beans, can also lead to hemolytic anemia. So, ladies and gentlemen, you should understand that the low concentration of NADPH, of course, it affects the conversion of the oxidized. It affects, of course, we know that glutathione is an antioxidant. So, and of course, the reduced form of this glutathione is the antioxidant form. So, of course, whenever this antioxidant or whenever this oxidized glutathione is not converted into reduced form, it means that it's also become an oxidant. So, therefore, the major importance of the NADPH, the major importance of the NADPH is to actually combat oxidized glutathione, is to combat the oxidized glutathione, is to combat the oxidized glutathione to reduce form. And of course, it's this reduced form that is used in scavenging the oxidant, and the oxidant can be, of course, hydrogen peroxides. It can be hydrogen peroxides or methemoglobin. And of course, if there is a low concentration of the NADPH, it means that the methemoglobin and peroxide will be accumulated in the red blood cells, which now actually affect the integrity of the membrane of the red blood cells. So now, but when the enzymes deficient subject, that is when the patient that is having deficiency of that enzymes is exposed to severe infections, so it is always advisable to administer oxidant drugs such as antimalarial, primaquine, antibiotic, such as that is like sulfamethoxazole, and acetanilides, that is antipyretics. And of course, there is a favism, that is ingestion of fava beans also leads to hemolytic anemia. So these are some of the consequences or the cases that actually cause anemia in the body. We have number 1, glucose 6-phosphate dehydrogenase deficiency, and then we have pyruvate kinase deficiency, and then hexokinase deficiency. So, ladies and gentlemen, thank you. And if this is the first time you are coming to my YouTube channel, please subscribe. So in the next video, we are going to look at the pyruvate dehydrogenase deficiency. Thank you.